Hello, good afternoon. My name is Juan Escobar. I'm a nurse practitioner who works in the emergency department. I'm about to give report to the OR unit because we're about to transfer this patient. This patient is Mr. Williams. He is 25 years old with no past medical history. This patient came to the emergency room complaining of abdominal pain. This pain started 2 days ago as a mild pain around the umbilical area that later on intensified and became localized in right lower quadrant. This pain is rated now 9 over 10. Is described as a throwing pain, constant pain. This pain, according to patient, is aggravated by movement, and the patient feels a little bit of relief when he lays down on bed and he flexes his legs against his abdomen. This patient was following by nausea and one episode of vomiting yesterday. Also, this patient is complaining of constipation that started 2 days ago, right after the pain started. Patient denies allergies. And in the emergency room, we did a physical examination on him. We found patient was febrile. Patient temperature was 100.5. Blood pressure was 125 over 79. Oxygen saturation on room air was 100%. Patient is alert and oriented. Patient skin intact. Respiratory system, we assessed the lungs. Everything was good. No, the lungs were clear. Patient denied any coughing or shortness of breath. In cardiovascular system, the heart rate was 105. Blood pressure, as I mentioned, was 125 over 79. No chest pain, no palpitations reported. On digestive system, the bowel sounds are present but are decreased. On a touch on abdominal touch, patient has McBurney's point positive. Patient with abdominal tenderness and rigidity when we touch over the right rectus muscle. Patient also has a psoas sign positive. This is pain with the right thigh extension. And also patient has obturator sign positive. Is pain with internal rotation or flex right thigh. After this assessment, we order some labs to assess more in depth to this patient. We order CBC, urine test, COVID test, and CT scan of the abdomen with contrast. After this result came back, we saw the patient has leukocytosis, high white blood cells count. The rapid COVID test was negative. And the CT scan showed an inflammation from the appendix. Also, the urine test was negative for infection. We didn't see any white blood cells or nitrates there, but we saw hematase, a small amount of blood in urine. With all this result, we have concluded that this patient is suffering from appendicitis. And so we started a treatment. We called the surgeon so he can come to evaluate this patient. And we started some measures and some treatment. First, we placed this patient on an MPO diet. We had an IV access to start hydration, 100 ml of normal saline in 1 hour. Also, we start giving this patient morphine for pain, 3 milligrams every 4 hours. Besides that, we started also giving 1 dose of Tylenol for the fever. And also we started this patient on an antibiotic IV, cefepime, 500 milligrams every 8 hours, preparing this patient for a surgery. So now we're giving report, we're transferring the patient to the OR. And after we spoke with the surgeon, he has concluded that he agrees with us. Patient is suffering from appendicitis, and they're gonna prepare everything. I forgot to remember also, we test this patient for a type and screen in case that we need any blood transfusion. And so we have prepared everything for that surgery. And now we're ordering also the rest of the test, like a comprehensive metabolic panel to see how is patient baseline of liver function and kidney function. Also, we are checking the coagulation on this patient. And after that, everything came back negative and within normal limits. So we're finishing the transferring of this patient to OR for the surgery. Thank you so much.